subject is how to make comfortable way to take care of a patient in the home. When I take care of my mother, and then as a caregiver, the first thing is caregiver must be in good health. If caregiver is not strong enough, then the patient and caregiver will going to fall down together. It's not just for patient, but what caregiver must be strong in order to take care of patient well. When I decided to take care of my mother, I told my mother, "Mom, I am going to give you just 10% of my capability. I am not going to take care of more than 10%. This statement make my mom, very disappointed. However, we have to let them know that there is a limit. We cannot do everything for the patient. If I am not strong, then I have to be taken care of by somebody else. In order to take care of patient well, I have to be stay healthy and strong." So you don't have to tell the patient that I am going to just 10% because my health is important too. No, you don't have to tell, but there is a limit. Because we do not know this caregiving is how long it's going to take. Maybe 1 month, 3 months, couple of years, nobody knows. So we have to admit this important fact that there is a limit. So this kind of concept or the criteria that okay, I am going to do up to what, okay? Then when I observe this one, some people believe maybe the bed using in the hospital, they just press button, then side up, down, maybe it's good. And in the hospital also, they put in the urinary, the tube. Then you put in the tube and get the urine automatically. However, in the home we are not able to do that. And then also once in a while we have to change the diaper and on the bed. This is not easy to taking care of alone. When I take care of my mother, she is weight is less than me. But it's not easy to lift her, holding here, lift. No, it's impossible. We have to lift, from the hip, then push it up, to go to bed, things like that. So therefore, sometimes, the patient could not hold, a bed well, then may fall down. Then there could be accident too. So the best one is that a little thick, a little thick and soft, a quilt, blanket on the bottom, and on the top of that I put the electric blanket to make warm. Then on the top of that, make sure you use linoleum you may be able to find out linoleum at the carpet store and get the right size. Right size. It is not that expensive either. So then when you clean up the urine and feces, it's very easy and to be clean. In the first time that I didn't have this idea. I put the blanket in there. Then when she make diarrhea, then everything coming out from the diaper. Then I have to wash that. Then even though I wash in a washing machine, then when I open, then there's a still that it's not clean all. So I have to wash again. So it's a very difficult for that. So when I start to use linoleum, then it's a lot easier to clean. So try to use linoleum. And the reason I use electric blanket under is when older people become older, they have tendency become chilly easy. Everybody different, and then however that on my mother's case, that she feel warm is better than cold, even though 95 degree, and she does not allow me to turn on the AC or even fan. So it's difficult. Now, so when you prepare, soft blanket, then electric heater, and on the top of that, you put the linoleum. Then you may be covered with sheet in there, and so in the beginning that she may be able to crawl to go to a bathroom, but sooner or later, even though she crawl to the bathroom, but she would not be able to alone sit up at the toilet bowl. So when she is in a hurry, she tried to go to, but in the meantime, while she crawling there, she made it. Then everything, the smell. Then it's a very difficult. So when you prepare those linoleum, I emphasize, then it's a lot easier for you. Then another thing is that when change the diaper, then you when you go to hip, then you roll down this way, then roll down this way. In the meantime, you push up. That's the way I do. But when I change the diaper and then cut the side, then it's a lot easier. Don't try to take off from the waist to the foot. No, just to cut. That's a lot easy, for me. And also, prepare lots of the a plastic glove, and also prepare baby wiper that is wet thing, and it's a lot easy with cleaning in the pelvic area, in the anus, things like that. So try to use baby wipe, and I try to use many things, but that is the most useful way to do that. So today I gave some information that how to prepare the family member in the home. Thank you so much for your watching.